Hey guys, welcome to our episode of Grit and Grace. And this episode, I'm very excited to bring you an interview. I'm going to interview Bethany, and we're going to go like inside of the patient's rooms. We're going to go with her in the rooms to dispel myths. There's so much confusion about hormones. And I am asked it all the time because a lot of my clients are dealing with some issues and they're talking to her. She's getting so many questions, and we've talked about it in some different podcasts that we've talked about, but this one is just going to go deep into it and going to ask her questions about what are clients asking, what is she telling the clients, and what are ways that she's very passionate about helping women and their hormones. And as she always says, you're not without hope. And so we want to make sure that you guys understand at a different level, so that you guys can make some better decisions and maybe get some questions answered from Bethany, or maybe even come and visit with her, because that's the best way to get your answers done, guys. So
yeah, this podcast was actually born out of a conversation that we had. We were drinking coffee a few weeks ago, and I was telling Christy how it absolutely amazes me how many patients every single day, and definitely every single week, come in, and usually I'm not their first stop. They've been maybe to their primary care doctor, their OB-GYN, and all those people are valuable, but maybe they just feel increasingly confused, or they don't feel validated at all in their symptoms. And so I was telling her, it just amazes me the misinformation related to hormones that patients come to me with. And so that's why we decided, let's just dispel these myths.
Yes. So the first question is, a lot of women come and they say, I don't need to think about hormones till menopause. Is that true?
That is so not true. So you can be depleted in hormones at various phases of life. So you can see this after a period of stress. You can see it, a lot of times people see it after they've had a baby, because hormones are completely all over the place. But, after you have a baby, you have had this cumulative period of stress, and so that can kind of flatline hormones. And then perimenopause starts about 10 years before menopause. And so I routinely see patients in their late 30s. My average patient age is 44, but hormones are not just for menopause. I would much rather see somebody at the beginning, so that we can buffer and coach them through what they're going to feel, rather than the average age of menopause in the US is 51, than to see the 51-year-old that has gained 30 pounds, that they have accumulated new meds and all of these things. So you actually need to think about hormones throughout your whole adult life, as far as how we can support those. And, I also say this a lot, that we can focus on fixing a problem, or in very conventional medicine now, you can go to your primary care doctor and they will be so happy to put you on an antidepressant. And then you gain 30 pounds, and then they will put you on blood pressure medicine, and then you'll be insulin resistant, borderline diabetic, and so you'll get metformin. And although there is a place for all of that, like, let's intervene and not just throw meds at somebody. Let's get to the root of the problem.
Yeah.
And so many times we can do that just by balancing hormones. And there's natural ways you can balance hormones too.
Yes. And I mean, just like you said, I mean, even with the clients that I talk to, the first thing they always tell me is, I've gained 30 pounds and done nothing different.
Yes.
And
and I tell patients all the time, and we say this, and people relate to it, that what you used to do doesn't work anymore. and so that's where all of this comes in.
Yes. Second question. It's a myth. People think you don't need to check your labs. Hormone symptoms alone tell you what's going on.
Yeah. And, I think there's two different schools of thought with this, and almost the very conventional OB-GYN mentality now, they just shut people down when they want their labs checked. Like, no, we do not check labs. You're still having a period, you're fine. And luckily, there's been enough people and enough social media and some different doctors that have written books that people are more educated now. And so they're seeking out, you have to be your best primary care provider. They're seeking out somebody that will check their labs. But I definitely like to look at quantitative data. I mainly look at serum lab values, which is blood, but there's all kinds of other tests. There's saliva tests. There are urine metabolite tests. There's a bunch of different ways that we can look at hormones, but I do look at symptoms, but I also look at that quantitative data, and then we merge those two things together to develop a plan.
Okay. One of the biggest fears that I hear is that hormone replacement therapy will cause cancer. Can you clarify this for us?
Yeah, and that's such a good question, and I go through that with every patient. So early 2000s to about 2002, a study came out called the Women's Health Initiative. And for those of you that are old enough, you probably remember that study, and it actually was introduced. New York Times says all women need to stop hormones, and literally women, their doctors took them off hormone replacement like overnight when the study came out. And it has taken 20 years to get past that mentality. So the study had so many flaws in it. And really, the study, there were several flaws. So what we know is that it depends how you give estrogen. And estrogen doesn't cause breast cancer. So estrogen could feed a breast cancer if you had it. And so it's important to do screening. It's important to do a mammogram or an ultrasound. Some people do thermography, MRI based on risk factors. But it's important to do screening. But breast cancer doesn't cause, or estrogen doesn't cause breast cancer. And this is one way to look at it. So think about it. Which decade of life is estrogen the highest in a female? It's the highest in your 20s and 30s when you're childbearing. And that population has the lowest incidence of breast cancer. So if estrogen caused breast cancer, 20 and 30-year-olds would be the ones that had it. Yeah. So the bottom line is there's so many benefits to estrogen. Single best way to protect your brain from dementia. Single best way to protect your bones from osteoporosis. Cardiac protective if given the right way. And so we shouldn't be scared of estrogen. I'm actually scared not to take estrogen because of brain, bone, heart, other benefits.
Yes. Okay. Now, as a trainer, I hear women say they don't need testosterone because it's a male hormone. Is testosterone important for women too?
Yes. So in your prime, in that 20 to 30 decade, you have just as much testosterone as you do estrogen. So testosterone supports brain health, bone health, energy, libido, muscle mass. So when women's testosterone starts waning, it's like the first female hormone to wane. That's one reason so many women complain of central belly fat and fatigue, loss of muscle mass. And so that is all testosterone driven. And this is one of the most common things that patients tell me. I just had a patient a few weeks ago that said that they were like kind of ousted at their OB-GYN office when they brought up testosterone. And so the goal too is, and I think this is a myth where we're a little bit divided, is people think that we want these super therapeutic doses of testosterone. We just want to optimize so that you're normal.
Yes.
We just want you to feel normal. Yes. So it's when you get super, super high levels that you see the excessive hair growth and the acne. If done correctly, then we just want you to feel normal and have good muscle mass, which equates to longevity and health span and all the things we talk about.
Yeah, and myself included, and I have so many friends and clients that once they have started their testosterone therapy, I think the most common statement I hear is, I feel like myself again.
Yeah.
And their energy is back. And so many people that are not on that type of therapy, no matter how much sleep, how much rest or anything, they do not feel rested. They're always tired. So yes.
And I think it goes back to what we talk about a lot in our various conversations here, is that we just kind of settle for the way that we feel. And so we don't even know how we should feel. And 40 is not old, 50 is not old, and you should feel good. And
Yeah.
we shouldn't just be complacent with, okay, I feel super tired.
Exactly.
That kind of thing.
Yeah. So since we're talking about testosterone and strength training and how it helps build muscle, some women are afraid that lifting weights and balancing hormones will make them bulky. What's the truth?
Yeah. Well, so we know that that's not true. Muscle is pro-metabolic. So when you build muscle, that increases your metabolism, which helps maintain a healthy weight. And so low testosterone or low estrogen can actually stall that muscle growth. And it can also stall fat loss. And so muscle and lifting weights improves all aspects of life.
All aspects.
And so with the hormone optimization, you can see just that you feel better and that your body's more efficient in all processes with that metabolism, and you're not going to have a bulky body.
Yeah. So another myth I hear is you can only use hormone therapy for a short time or it's unsafe. What do you tell your patients?
Yeah, so that is like one of those Women's Health Initiative myths from about 20 years ago. So once we put people back on hormones after the Women's Health Initiative, then it was like, okay, we're just going to use it for the shortest duration of time. And so you can definitely treat and work on balancing hormones during perimenopause, but the most important decade to treat is the decade after menopause, so 50 to 60, you could say. And that's where estrogen can help build bones. You can have that protection against dementia, the cardiac protection. Now, if you're doing well on hormones, you can stay on them for as long as you want the benefit. What I tell people, if I have a 65 or 70-year-old come in, we have to look at them and go, okay, do we have cardiovascular risk? Do we have other risk? And so they're not going to get the same benefit that that person gets that starts right when they're menopausal. So there's no end to treatments is the bottom line.
Okay. So people think a pill, a patch, or a pellet do all the same things. Is that true?
Yes, so not all hormone deliveries are created equal. And this goes back to that Women's Health Initiative. And so it's a conversation that I have with every patient. And so when you take estrogen by mouth and it's metabolized via the liver, it increases clotting risk. And so birth control increases clotting risk for that same reason. And so we really try to avoid oral estrogen. So there's all kinds of different deliveries, but transdermal estrogen, which is a patch, a pellet, or a cream, bypasses that liver metabolism, so it doesn't have the same risk factors. So with every kind of therapy in every patient, whether it's testosterone or progesterone that we're putting them on, or estrogen, or all three, we want to evaluate the risk factors and how we're doing it, and also, is the patient going to be compliant? Like, are you going to be compliant putting a cream on every day? Does your lifestyle fit more into a pellet that you don't have to think about? So it's tailored, it's individualized care, and I use bioidentical hormones that we work to use hormones that mimic what your body made already.
Okay. I love how you cut through the confusion, and I appreciate you sharing what you're telling patients and with the most common questions that patients are asking. And the truth is, hormones don't have to be scary, and they can actually help women train smarter, feel better, live stronger, and when they're managed the right way.
Right.
So just to recap what she said, that it's not just for menopause. And you know, when you're in your 30s and you just start to feel off, and just like we said, what used to work doesn't work in each decade. Every decade, you're learning something new about your body. Hormones are changing every decade. You're changing every decade. Your family dynamics is changing every decade. So just know that it's not just menopause that you have to worry about hormones, and it does not always cause cancer. So hopefully that clarified that also. And testosterone is vital for women, and it's not unsafe when it's monitored, and all routes are equal. So if you want which route is best when you and your provider is talking about it and works best for your life, you know, that's a discussion that you have with somebody, and don't do it by yourself. You're not alone in this journey.
Yeah. I tell women all the time, because I'm privy to talking to so many women, and I do think that we feel like we're the only person that feels that way. But everybody really feels the same way, but we don't have to. And so don't settle for just adding meds because you don't feel good. Really, let's get to the bottom of it and benefit from it. So look at the data and find a provider. We would love to see you at Grace Wellness, but truly our heart is for women that don't feel their best to help them feel better.
Yes.
Whether it's at Breaking Barriers or at Grace Wellness.
Yes, 100%. So I hope you guys learned a lot from this episode, and I just appreciate learning what's going on behind those doors.
Yeah.
You know, she's a wealth of knowledge. I've seen her teach before at a Thrive Women's Conference, and you can see the passion that she has for this. So what a blessing it was to bring this to our listeners.
Yeah.
So we also want to hear from you. We want to hear from you and ask us questions. Comment on here. Did we clarify anything? Are there any other questions that you would like to have answered? Or are there any episodes that you would like for us to talk about? Besides hormones, and we've talked about fasting, and we've talked about inflammation, we've talked about our trips together. So talk to us.
Yeah, absolutely. And then just a reminder, another thing that we have coming at Grace Wellness, October 9th, is our second series in a little educational lunch series that we have, and it's going to be titled Mindset Reset. So we talked about nutrition and hormones the first series, so there's still time to sign up for that. And there again, our goal is just to invest and educate and empower you to be healthier.
Yes, to be your best. Because just like she said, if you're not feeling your best now, why settle for that for decades to come? So,
right.
thanks, guys.
Okay, thanks.